as in other areas of telehealth, and historically, telehealth hasn't gotten the attention and the due that it's deserved from the federal government, even given the history of funding of the early and ongoing telemedicine efforts. You know, there are lessons to be learned and experiences there that go back 30, 40 years to the Logan International Airport telemedicine project in the early 60s, and NASA's efforts on the StarPac program and the Papago Indian Reservation in the 70s, and a lot of federally funded efforts through HRSA, the Rural Utilities Service, the NTIA within the Commerce Department, and more. Hundreds of millions of dollars that have gotten this field up and running, and almost to a point of sustainability. That begs the question, why haven't we, in a macro kind of way, not only looked at the outcomes of all of those projects, but incorporated all of the work that has been done, the technology, the development that has occurred as we move forward towards the broader e-enabling of the healthcare environment. You know, we not only need to look at certification modules for EMRs that have to do with telehealth and the adjuncts to it for remote disease and chronic care management technologies and how they fit in, how it's all going to fit into health information exchanges and all of the rest. And yet the underlying legislation, high-tech within the Recovery Act, for whatever reasons, mostly having to do with, I think, funding, left out some whole categories of provider, and it left out, for the most part, telemedicine and telehealth. So now what? Now we're left with, administratively, before the Standards and Policy Committees of the Office of the National Coordinator, trying to make the case that in stages 2 and 3 of meaningful use, we ought to build in some at least addressable objectives that go to the issue of telemedicine and disease monitoring and management. Longitudinal care is the objective here, transforming the system in the way in which we provide healthcare services, and we know from experience that telehealth can play a large role in that whole effort. So why aren't we, if not insisting on it as part of the, say, national strategy that just came out, the 5-year, longer-term national strategy for HIT, making it at least an optional sort of thing, because then vendors would build to it and include modules having to do with telehealth and disease monitoring as they promote EMRs and HIE-like solutions in their products and services.